The symptoms of tongue tie for a breastfed baby can include poor weight gain, slow weight gain or weight loss, a difficulty with the latch. That latch can be shallow, there can be clicking or smacking sounds frequently during a feed. They can frequently slip off and on the nipple or have difficulty maintaining that latch. They may get frustrated at the breast or they may tire easily, and they may have difficulty with reflux or colic symptoms or looser bowel motions. Difficulties for the breastfeeding mum unfortunately include maternal nipple pain and trauma, distorted nipples, bleeding or cracked nipples, mastitis or engorgement as a result of inefficient milk transfer. Bottle-fed babies experience a slightly different set of symptoms. They can often suffer from reflux or colic symptoms. They can dribble out or lose a lot of their milk outside on the sides of the teat while feeding, and they can often kind of gag, choke or cough during feeds. Difficulties for a weaning infant can include difficulty moving on through the textures, progressing from the very thinnest texture, coughing, choking or gagging on feeds, food refusal or just kind of spitting the food back out. There's growing evidence that tongue ties can impact speech, especially consonants like R's and L's, but it is impossible to know which babies will have their speech impacted by tongue tie. Other symptoms that are associated with tongue tie and speech include muffled or low volume speech, especially when having to speak for a long time or speak fast. Tongue ties can also be associated with poor head and neck posture, mouth breathing, sleep disordered breathing, and poor dentition.